Hello, my name is Dr. Marc Calabrese. I'm one of the urologists here at Fore Urology. And if you're watching this video, this means you're interested in learning about having a vasectomy done. And the purpose of this video is to review the technique with how a vasectomy is done and how the procedure itself is done in the office and the expected recovery time and risks. So, how a vasectomy works is by dividing and blocking the tube that is called the vas deferens. So if this is your testicle, this is your epididymis, which is a little tail of tissue that comes off the back of the testicle, and then you have this long tube called your vas deferens, which comes off the bottom of your testicle. And you have one of these on each side, and basically how this all works is your testicle will produce sperm. That sperm will travel up that long tube called the vas deferens. Eventually, that tube on each side will travel all the way up into your pelvis and connect in what are called your seminal vesicles. Your seminal vesicles are little pouches behind your prostate, and it's actually where your semen is produced, the fluid of your semen. So that is where your sperm joins your semen, and ultimately that's how you're able to have children. So what we do for a vasectomy is we block off that tube on both sides. It's done through a combination of using microscopic surgical clips, by removing a small segment of that tube, as well as using cautery to seal the inner edges of those tubes. By doing that, you will continue to make semen when you ejaculate, but your semen will not have any sperm in it. Therefore, you won't be able to conceive. Okay? Two important things I always tell you when I first give this talk. First important thing is that a vasectomy does not immediately start working. There's a couple of reasons why. So one reason is there still is sperm in this tube after the vasectomy is done. The other reason is there's still semen in your body that has sperm in it. So because of that, you do need to continue to use contraception to prevent pregnancy after the procedure, until you will ultimately get a semen analysis or a semen test done approximately 3 months after the procedure to confirm that you don't have any sperm left. And at that point, you'll be given the clear or go ahead to stop using contraception. The second important thing I always start off this talk with is that you should come into this expecting this to be permanent. And this is something that should be discussed with you and your partner, and you should both understand that you expect this to be permanent for the rest of your life. So the procedure itself, this is something we do in the office. So because of that, you are awake for the procedure. Now I do offer to give you a medication to help you relax for the vasectomy. It's a medication called Valium that you take about an hour before. And the Valium will help you relax and kind of lets the procedure go a little smoother for guys that have some anxiety about the procedure. The only thing that's important about taking the Valium is it does mean you will need someone to drive you for your procedure. All in all, the procedure takes about 20 or 30 minutes. And the whole procedure is done through one small opening right in the middle of the scrotum. Obviously, since you're awake, you will have plenty of numbing medication, so you won't feel any sharp pain. You still will feel a little pressure, pulling, tugging, kind of similar to having an exam done, but the Valium can kind of help with some of that discomfort. Afterwards, you'll have a small suture that will kind of close that opening on your scrotum. That suture will dissolve on its own, falls out after about a week or two. In terms of kind of recovery time and afterwards, so for really the next couple of days after a vasectomy, I ask that you don't do a whole lot. Mostly kind of hang around the house, really taking it easy, using lots of ice. The reason why is if you do too much too soon after a vasectomy, you can get a fair amount of swelling and bruising, and that can take a good amount of time to fully go away. So it's important to take it really easy for a couple of days after the procedure. Guys can resume kind of normal showering the day after the procedure. Just can't soak in a tub or go for a swim for a week. And also there's no strenuous exercise and no heavy lifting. Try to avoid anything more than 15 pounds for a week. And there's no sexual activity for a week. Basically, once you're a week out from the procedure, you're usually fully healed and you don't have any further restrictions. In terms of the risks of a vasectomy, there's always a small risk of infection. So one thing is that I do ask that you shave the day before the procedure to help clean things up a little bit. Just with clippers is fine. There's always a small risk of bleeding. And again, some bruising and swelling is always normal and expected. Generally, it's pretty rare to have any more significant bleeding than that. It's really rare to injure the testicle on either side. There is a small chance of getting what's called epididymitis. So epididymitis is when you develop an infection in that tail of tissue that sits behind your testicles on one side. While it's not common, if it does happen, it tends to pop up in the first week or two. You'll notice a little more swelling, a little more discomfort on that side. And if that's the case, then you just get a course of antibiotics, which will usually take care of it. There is a small risk of developing what's called a sperm granuloma. It's not common, but basically a sperm granuloma is when a little bit of sperm can leak out from one of the ends of that tube after the procedure. And you get this spot that feels a little sore, almost feels like a little nodule on the inside. The good news is it's not dangerous, it's not harmful, and rarely anything has to be done about it. And it's also, in general, very rare. So an important thing to know about a vasectomy is that there's always the risk that vasectomy can fail. In general, that's rare. The risk of having a vasectomy fail after having the test confirming that you don't have any sperm left or having a very few amount of non-motile sperm, it's roughly 1 in 2,000. So while it's rare, there's always, unfortunately, a very rare chance that you can still conceive after having a vasectomy. Another rare risk of a vasectomy is the risk of chronic testicular or scrotal pain after the procedure. It's estimated that this happens about 1% of guys, and basically they can develop this basically chronic or achy discomfort in their testicles or their scrotum, and it can be a little tough to manage for guys who do get it, but fortunately it is rare. And certainly during your consultation with me in the office, you'll have the opportunity to ask any questions that may come up after watching this video. You'll also have a short exam, and we'll kind of go over the specific details that go about scheduling the procedure and any other questions you may have. Thank you for watching this video.